We all like to talk about our health, right?
Yes, we do.
And we all like to make sure that we live a healthy lifestyle and take care of ourselves so we can live long.
That's
Right.
true. I agree.
The conversation today is about the healthcare system in Zimbabwe. And I'm happy to have the conversation with my brother here, Leon,
Yes,
coming all the way from Ohio.
that's right.
Welcome home.
I'm glad to be home. And cheers.
Cheers to another
Hot
day
day in
in Africa. Salibonani, Makandi, hello and welcome to my channel, Kaya's Gogo. My name is Subongile and I am just chronicling my settling back in Zimbabwe on the mother continent. It is time for us to take the narrative, right? To control the narrative and to talk about the realities of our continent, the good, the bad, and the ugly. So the conversation today is about healthcare system in Zimbabwe. So a lot of my subscribers have asked me, hey, you've settled back in Zimbabwe. Tell us about healthcare. And let me talk about the two systems that are here, the public healthcare system as well as private healthcare. Now, let me discuss briefly about the public healthcare system. We have here in Bulawayo, we have the two main hospitals, the United Bulawayo Hospitals and Mpilo Central Hospital. Then we have the council clinics, the public health services run by the city councils. With the major hospitals, they cater to all the big things, in terms of surgeries, hospital, inpatient and outpatient services, maternal child health, which includes pediatrics, obstetrics, and the general hospital services, orthopedics, cardiology, etc. Now, I cannot tell you specifically how the hospitals are like, because this is not the time to be going to the hospital if you don't need to. So I have not been able to visit the hospitals and see what they are like, but I can tell you from what I've seen of the external, talking of UBH, because it's a hospital that's closest to me. It still looks the same as it was some 20-30 years ago. What does that mean? Maybe nothing, but I couldn't tell you whether there are any upgraded upgraded equipment inside, or we are still using the old tools. What does that do to the system itself? If there are no upgrades to the equipment that is used by the staff, it makes it difficult for the staff to do their work. It makes it difficult for the patients to get the best care possible. So on that regard, I cannot speak specifically of how the hospitals look on the inside. I've not been able to visit. But I just can say I haven't seen any expansion of these hospitals from the outside. In terms of private facilities, the one that I know of is Mater Dei here in Bulawayo. That's where my daughter was born. On the outside, it still looks the same.
Okay.
On the inside, I don't know if there are any upgrades to the inside, but it's still the private hospital that is available here in Bulawayo. There's also the one at the corner of Cecil in the old Esgodini Road, and it's called Egusileni. It is not open for public use. It was supposed to have been used for the COVID patients. I know there are no patients yet, but it looks like it's a beautiful facility that unfortunately is not in use at the moment. There are private health insurances that are available. You can either be in a company that subscribes to that. You can do it as an individual, as an entrepreneur, a corporate, whatever. So I can just list a few of the insurances that people have suggested for me. I am not saying in any particular order one is better than the other, but these are the ones that a couple of people that I've spoken to have used and are recommended. I will put the links in the description below. Look up their services online and see if they meet your needs. So in no particular importance, I'm going to list Masca, Corporate 24, Alliance Health, Calm Health International, and Cimas. So you can have private insurance, which will give you care in the public hospital as well as the private hospital. There are also tiers, levels to these to what they provide. So depending on the level that you've chosen and how much it costs, you would get basic services, intermediary services, as well as the full pack of services that are offered by the insurance. All of them will offer you, a full visit to the doctor, some of them will have a shortfall, some won't have. Again, it depends on what you have chosen. You can have visits to the doctors, you have emergency services, you have inpatient services, whether you have a private room or where you're sharing with other people. It all depends on the package that you have taken. I am not at liberty to discuss each one of the packages because I am not a representative of these companies, and I am not being sponsored by them. By listing their names, I am not endorsing them. I'm just giving you information on the services, insurance companies that people have used, and they recommend them. There is also, some of them will list global international care, where you can be airlifted. I know there was a time when that kind of service had been put on hold by the government, so that people were encouraged to use the services here. If you are a foreigner, and you have that service and your insurance can still airlift you out, I think it still is an option. But I think that was specifically to Zimbabweans seeking medical tourism. And there was kind of a pushback on that. But what I want us to remind each other is, I think the best we can do is to try and take care of ourselves the best way we know how, so we avoid having to go and be hospitalized. So good eating, rest, exercise, good mindset, less stress. Debatable here, because yes, it can be stressful here, and it's not a choice for most people to have some comfort living. People are living from hand to mouth, so it is not that easy. But where you can, reduce your stresses, so you avoid, being sick. And in this time of the pandemic, really honestly, what I would encourage all of us to do is adhere to the public health information that we're getting to stay safe. Hand washing, sanitizing, putting on our masks, avoiding public places where there are crowds. Here you have all the time to spend outside with windows open. Even in the cold weather, it is fairly warm. Today was one of the cold days here in July, but you can still be, outside or keep the windows open. As much as possible, taking care of ourselves and each other to minimize the spread. that is one way of us, keeping off the hospitals. But in the event that you have to be hospitalized, this is what we're talking about, that the private and public healthcare is there, although it is shaky and struggling. Yeah. I choose not to live in fear. I choose not to live without looking at what is possible and positive. I try and be mindful of the fact that, yes, we do get our bodies injured, and we do the best we can to take care of the injured body. But that, knowing fully well that the Zimbabwean healthcare system is on shaky ground, I still chose to come. And I'm okay.
And I'm glad to visit you.
I'm happy that you're here.
Yeah, that's right. I am glad to be here.
Yeah. So for anybody who's out there wanting to come and visit, I don't think it is fair to say don't come because the healthcare system is in shambles. There is a lot to like and live for here. Just being mindful on how best you can take care of yourself. Yeah. This is a beautiful country.
Yeah.
It's a beautiful place.
I love it. So what about the doctors who can visit you at home? You haven't talked about that.
Well. Good question. We've had the experience of having to use a doctor who came to visit at home. Not my home, but I have an uncle who is not doing well, and we were not able to transport him to the hospital. It was easier and better for him to be seen at home. And we got a doctor to come in and visit at home. So that kind of service is available. I do encourage diaspora Zimbabweans and anybody who loves this country to visit, to come back to the country and live. When are you coming back?
Very soon. Very soon. The plan is coming together. So one of these days it's going to happen.
And then we'll be, toasting it to another hard day in Africa.
That's right.
Yeah, I love the fact that even under all the hardships that us as Zimbabweans face, we still are coming out with smiles. We still go out there and do the best we can. And this is why I'm confident that when you have the right mindset and you are able to, take care of yourself and protect others as well so that we stay healthy, it is not a bad place to be. I think prevention is the best medicine, and whatever it takes for us to prevent where we can, that is our best line of defense. Public health and private health care is available in Zimbabwe. You would not be denied care. You would not fail to have some care. Just remember that this is not emazweni. This is Zimbabwe. Basic health care is available.
Right.
Yeah. Thank you for watching. Please be sure to subscribe to my channel, share, like, and comment. And don't forget to ring the bell so you can be notified when my videos come out. Till the next time, take care of each other and yourselves. Bye for now.